Hey, Steph.
Hello.
Welcome back to another episode of Bariatric Banter Podcast.
25.
5, a quarter. We have hit a quarter of
25.
whatever it is we're doing.
Of whatever this is.
Yeah. We're a quarter of the way to 100, folks.
Oh my gosh.
I know.
Can you
That's gonna be
imagine when we hit 100? We'll have to have a party.
nuts. I know. We'll have to
A
do something.
recording party.
Yeah. I feel like a meetup is in the books.
Just
When-
me and you partying with balloons.
Oh,
Woo!
hey, woo! But we've been kind
Some
of
mocktails and balloons, baby.
thinking about. We haven't planned anything yet, but we have been thinking it might be cool to do a little
Should do
meetup
something.
for people that are local that maybe want to hang out and do something. But yeah, we're thinking about the next 25 episodes of this little
Yeah.
podcast and how we can maybe do a bit more with it or start to do some more on-site recording, maybe get Cass
Yep.
back in. And
Yes.
we definitely want to start inviting some other people in too. So I think that could be really cool.
Yep.
Um, yeah, 25 episodes. This is
Crazy.
cool. And our new
Love it.
format, doing well, shorter format to just take a little bit of
Sh-
pressure off ourselves.
Short and sweet. Yeah.
Short and sweet. This week's episode is interesting because I do actually get a lot of questions about it. And I went
Oh
back
my
through
gosh. Yeah.
episodes and I was like, we've already talked about this, haven't we? And no, what we talked about was like orientation and being in the
Right.
program. But what people wanted to know was like, what were the requirements to get into surgery?
Yeah.
And I
What
realized
did the pre-process look like?
yeah, and I realized we never talked about it. We only talked about orientation onwards, so, like,
Right.
already being in the program.
Right.
I was like, "Oh, this would be really interesting to cover,"
Yeah.
because I'm sure it differs in the US than it does here, but I think there's a lot of misconceptions about what needs
Yeah.
to take place before you get in. Um,
Yep.
so that's what we're gonna talk about
Yeah.
today is
It's
what are
yeah.
the requirements to have
Before
this surgery? To
it's
get
funny because right. It's funny because I had, a couple, we'll say, events, like in-person things in the last couple months, in town, and have seen a lot of people that I haven't seen in a long time, like since pre-surgery. And so, you get the, "Oh my gosh, look at you," which is great. But then I had a couple people who either pulled me aside at those events or have messaged me since and said, "Hey, okay, I got to talk to you now because I've been thinking about this. I've always thought about it, or I've newly thought about this, but what do I have to do? Like, what do I do to get this started? What do I do to get my foot in the door? How do I begin this process? What do I need to do?" So it's kind of funny timing because I've probably had, I'd say, in the last 2 months, 3 people who have asked me the same question and are typically surprised by the answer. So I think people, like I said, there's a lot of misconceptions. I think people think it is much more involved than it really is. It's not.
yeah, and I think it's because it's like some other things in the
Yeah.
medical world where you actually have to prove that you have to, like, basically prove to get
Test
accepted.
after test
Yeah,
after test.
right.
Yeah.
I remember we were talking about cholesterol injections because high
Yeah.
cholesterol runs in my family, and I was kind of asking my mom, like, "Hey, I hear there's an injection, and it's supposed to be, less invasive than the pills and blah, blah, blah." She was like,
Yeah.
"Okay, so first of all, it's like $6,000, and to get
Ugh.
approved for it, you have to show that you've gone through multiple different processes, that none of the other things are working, bop, 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 bop." And so, sorry, had to respond to something. You had to prove without a reasonable doubt that you've tried everything under the sun and then
Right.
maybe recover it. So I think it just comes from, like, medical history,
Right.
people thinking, "Oh, I have to prove stuff." So I'm
Well,
glad
yeah.
we're talking about this. I'm glad
Yeah.
we're gonna, and again, this is just for Canada. It probably
Yep.
does differ other places,
And
but
different programs will also differ. I know some people who have had surgery in another program and they had to get different pre-testing than we had to. But I agree. I think it's because a lot of times, let's be honest, we have to jump through hoops to get things, especially I'm not gonna go down the rabbit hole, but especially when you're obese to begin with. There's typically a lot of hoops you have to go through or testing you have to get done because they want to find out what's the ultimate cause, what all is contributing to this, what is leading to this, why do you feel this way? And so I know personally for me in the past, um, we did fertility treatments for a long time. And so it was test after test after test after test. And I think maybe that's part of the reason why I never thought about surgery was because I just never brought it into my mind because I just in the back of my head assumed, oh, it's going to have to be another one of these testing and waiting and go through this and then have this done. And then once that's a no, we'll go this. And I just didn't even want to go down the rabbit hole of what I assumed it was gonna be like, so it was never a thought that crossed my mind until my doctor suggested it.
Yeah, and I think I also, just kind of assumed they would just tell me, that it was one
Right.
of, "You don't go into this, they
Yep.
tell you," right? Like, you wouldn't go to the doctor and be like, "I would love to discuss high blood pressure medication with you." Like, you
Right.
he'd be like, "We need to talk about medication,"
Yeah,
and it's like,
exactly.
"Okay."
This is
So,
happening.
I think there's that misconception too that, like, well,
Yep.
they'll just tell you when you need this. So,
Yeah.
let's talk about, I think, first and foremost, the question basically was, what is kind of it was basically kind of like what's required to get into surgery. I think it was like,
Yep.
what were the requirements or milestones that you actually had to accomplish before surgery. So to get into the bariatric program, and I honestly shouldn't use the word get into, to start the bariatric
Yep.
program, there is nothing that you need
Just gonna
to.
say the easy answer is nothing.
Okay, so like, nothing with an asterisk.
Mm.
Let's say
Yes.
nothing with an asterisk. There really wasn't anything that was required.
Nope.
Asterisks. You have to be a certain, okay, back in the day, I think you had to, but, like, there was back in the day, like, you had to be a certain weight, you had to have a certain BMI.
Back yeah, back in the day, yeah.
I think if you're, like, 5'4" and 150 pounds and you go to your doctor and you go, "I want bariatric surgery," the chances that you're
Eh,
gonna be allowed to have bariatric surgery are pretty fucking slim,
yeah.
because
You probably
A,
don't need it.
you don't, and B, like, you don't have 100 pounds to lose, right?
No.
With
Let's
the
let's look at
medication
other
in
options.
place.
Let's look yeah.
So, basically, it is reserved for people that need it type deal, like, you have to be.
You're usually obese when you're
You're
having
usually
bariatric
obese, but
surgery.
not always. There are some
No.
people
No.
who are overweight that did have this
Yes.
surgery, but
I'd say the
basically
majority are
are
people who are obese, who have tried other things, who have other underlying health problems, but
correct.
typically your doctor, you're not gonna bring it up or your doctor's not gonna refer you for it or suggest that they refer you for it unless you clearly, visibly,
You
obviously need
need to
it.
lose the weight, right?
Yeah.
If you're thin and you are thinking of this, they might be like, "We need
Suggest other things.
to talk about this." But basically,
Yeah.
there isn't like, I did not have to hit a certain I didn't have to be a
Yep.
certain weight. Now, if you Google and research it, I thought I had to be a certain weight, and I was like,
Right?
"Oh, no.
Yeah.
No." If you are considered
No.
morbidly obese, which, like, most of the people having the surgery are, you
Yep.
literally can go to your doctor and say, "I'd like to have weight loss surgery." Your doctor is not the one performing that surgery. They'll have
No.
little to no involvement in that. You literally just need a recommendation from them. So
Yeah.
if your doctor's giving you shit about it, go find another doctor because
Yep.
they are gonna put you into a program. It's not like your family doctor has to do all this work and has to be in,
No.
like, so if you don't have a family doctor, go to a clinic and ask the
Yeah. They're
clinic.
literally filling out a piece of paper. That's
That's
all
all
they're doing.
they're doing. They're just filling out a piece of paper. The clinic
Yeah.
will literally take over from there and do all your pre-testing and all your pre-work and everything for you. But I
Yeah.
did not have any, like, questionnaire or anything beforehand.
Nope.
My doctor did say to me, like, "I know you've tried. I know that you've
Yeah.
been going through personal training. Like, I know that you've put an effort in." So there was no requirement, but my family doctor kind of alluded to what some family doctors might. Have you at least put any effort into this or have traced this before? That is not a requirement, so please don't
Yep.
feel bad if you haven't or you haven't
No.
talked about it with your doctor, like, that shouldn't prevent you from it, but he wasn't doing it to say, "You can go do this on your own." He was basically
Right.
saying, "I know you have the dedication to do this
Mhm.
because you've been trying." And for a
Right.
lot of doctors, that's what it is. It's not that they expect you to lose weight. There is no, "You need to lose X amount of weight to
No.
qualify for this." Nope, but he basically was saying,
Can you be successful
"You
at
will
this?
succeed with this because you've been
Yeah.
trying hard on your
Yep.
own." So,
Exactly.
while not a requirement, if you've put no effort in and you're
Mm,
listening to your
it's
doctor
it's a
and
red flag.
you
It's a
know,
red flag.
he or she will probably, I keep saying he, not because I'm sexist, my doctor man, and I keep picturing Dr. Singh in my head while I'm talking, but they will probably have a few more questions for you up front and maybe even paint to
Yes.
you how much of a journey this program is and ask you, "Are you really sure that you
Right.
can do this?"
They might wanna put it off a little bit, have some more appointments with you, have give you some more time to really make sure because as we've discussed, again, we're not gonna go down the rabbit hole, it's not the easy way out, there is a lot that goes into this, and so they just wanna make sure that if you're going to do something that is this drastic and this big of a change, that you're in the right place, you're in the right mindset, you are at the right point where this is the right decision for you. And that's, yeah, like I had a new family doctor and I had very bad experiences with my previous family doctor. And it's funny because my parents have had, well, mainly my mom, but my parents have had really good experiences with him. I did not. I did not like him. Had a lot of bad experiences with him with our fertility stuff. And so we had a new family doctor moving out here and I had been working out for a while. I've been doing all the things. Um, and as we've talked about, you see your success and then you plateau and then you gain and then success and gain. It was just, I'm said to Devin and with perimenopause and PCOS and da da da, said, I'm done with this. I'm going to go talk to the doctor. I don't know her. I've heard good things about her. I'm going to go lay it out on the table. And so I went to her. I put notes on my phone because I knew I was going to be nervous. And I
That's smart.
knew, yeah, I knew once I saw her, I was going to be nervous. I was going to forget things or I was going to bail and just, I don't know, not do what I set out to do and not advocate for myself.
Yep.
So I sat down with her, met her. She seemed super nice. I had met her once or twice quick with the kids for vaccinations, but never for me or for a chat. So I sat down and I said, here's the deal. I said, clearly you can see I need to lose weight. Here's my history. Here's the issues I suffer from. Here's what's happened in the past. Here's what I've tried. Here's where I failed.
Yep.
I'm done. Like I said to her, I'm sick and tired of being sick and tired of feeling like crap, of not having success. I'm busting my butt. I'm getting so discouraged. And we had a really good chat. And I fully expected her to go down the like Ozempic Monjaro route. And as I've said before on here,
Okay.
no judgment to
Nope.
anyone who does it. If
That's
that's what
okay.
you want, yeah, and that works, go
Do
for
it.
it. I had a lot of negative side effects with fertility medication and injections. And so I'll say like PTSD towards the thought of injectables. I can't do it. I can't do it.
Yeah.
And so that was where I was prepared to take the conversation and never came up. Her very first comment out of her mouth was we had a great chat. She was very receptive and she just looked at me and goes, well, what about surgery? And I literally, it hadn't even crossed my mind. I literally said, what surgery? Like thinking I'm not here for like appendicitis. And she's like, bariatric surgery. And I just stared at her and I was like, no, no. And she told me all about Guelph and she said how they have a nutrition program, which is shake meal replacement based, and they have surgery. And she goes, you tell me you want me to put a referral in for you and I will happily do it. And I asked her some questions, and to your point, the doctor has nothing to do with it. She, other than the knowing they have 2 routes you can take, she knew nothing about the program, nothing about anything. She goes, I fill out the referral and then they call you. And I was like, oh, okay, perfect. So that day, she filled it out that day and sent it in. And then from that point on,
Yep.
she's
But
been
none of
involved in
that.
my no, she's been involved in my follow-ups,
Yeah.
but that was literally all it took to get the
Th
referral was a conversation.
And none of what you did, so, was required. So I just want, like,
No.
no, none of the, like, having it written down and talking, none
Nope.
of that was
That was
required.
just for me.
There are no prerequisites really. There
No.
was back in the day, like, weight ones. So again, if you're
Yeah.
maybe not morbidly obese or obese, maybe there's another conversation you're gonna have, but if you're obese
Yeah.
or morbidly obese, don't worry. There is no, "You need to do this to get in." Um,
Mm.
and when I was entering the program, Ozempic and all that stuff was not prevalent, so
Yeah.
maybe we would have had a discussion about injectables instead of surgery, and
Right.
maybe I would have went down that route because they were not as widely done
Yeah.
now as they were back then, and it's okay if your doctor wants you to maybe take
Yeah.
a weird approach or think about things.
Totally.
That is fine. Also, keep in mind, you will be in this program for upwards of 11 to 12 months before you get in. So maybe do a combined effort. Let's start the injections, but please put me on the list for surgery anyway, because it's going to be an 11-month wait period.
Yeah.
Um, but basically, there is no requirements.
Time out. Please.
But basically, not, yeah, none of that is
Yeah.
required.
No.
And I think if you Google it, you're going to see things like BMI of 40 or higher, BMI of blah blah blah.
Yeah.
Like, no, there was literally nobody. There
Nobody
was
checked my BMI.
Yeah, your doctor will just put you in. I think the requirements are you have to be an adult. Like, that obviously makes,
Yes.
but, like, I don't think once they required my BMI to let me in the program or not, because I was a bit
No.
like, "Is it high enough?" Like, bitch, of course it was
I
high
put it
enough.
on I remember putting it all like filling out all that stuff on the paperwork to
Yeah,
send into the clinic basically as my yes, I want to move forward, but I never had a discussion about it.
no. Now,
No.
the only thing I will say, and I've said it before on episodes, and everybody's heard me say it, there are things that will slow you down but not limit you. Like obviously, if you currently have cancer, if you currently have like, there's probably going to be larger conversations about that.
Smoking.
Yeah, but, yes, you can do this if you're diabetic. Yes, you
Yep.
can do this if you have heart disease. Yes, you can do this if you like,
Yeah.
they will handle that with you and talk to you about it. Where you won't be eligible though, and this is big, and they will tell you this in orientation, you cannot be an alcoholic or a drug addict. Sorry.
Yep.
Um, if you struggle with alcohol or drugs and you wouldn't consider yourself an alcoholic or a drug addict, but you really drink a lot, you need to actually not have been drinking for at least 6 months
Yeah.
if you are like a heavy alcohol dependency.
Yeah.
Once you enter orientation, they will say you need to stop drinking from this point on before you have, there'll be no smoking, no
Yep.
drug use, including marijuana, and no drinking while you are in the referral stage. And you have to agree to that. And
And
like,
they'll ask you at all your appointments,
yeah,
have you had anything to drink?"
if you've had major cancer, you actually need to wait 2 years after that to go into the program. But again, they'll work with you on that,
Yep.
and that's just because your body needs time to heal. It's not you can't come in, it's you can't come in for 2 years. Same with being an alcoholic or a drug addict. It's not
Yep.
you can't do this, it's you need to be clean for a minimum of 6
Yeah.
months to come in. Um, if you have psychiatric illnesses, again, it's not that you can't, but you need to make sure that you are very adequately covered, treated, and
Mhm.
have what you need. There are a lot of stories that you'll hear out there of people entering the programs and then having surgeries pushed and bumped because you're not actually working on your depression or your anxiety or your
Yeah.
like other issues that you have. Like there's gonna be a part where your medication's not gonna work as adequately as it did before, like, you have to have there's a
Yeah.
lot of things that, like, if you have underlying issues, you will need to speak with someone about, but, having diabetes does not rule you out. It does change what surgery you're allowed to have, that's fine, but I had raging high blood pressure, high blood sugar, I wasn't diabetic, but it was high, I had high
Yep.
cholesterol, I had joint pain, I was having muscle neuropathy, like, I was numb in one leg, nothing,
No, their
nothing.
comment was, "You're perfect for this."
Basically, they were like, "Let's fucking
Yeah.
go."
I wou I would
So
say though, like, there's not gonna say requirements, there's things I would recommend
sure.
you do before surgery, and there's foundations I would suggest that if you're seriously considering having the surgery, they're not
Yeah,
requirements by the program or by the doctor, but I would
no,
say would help set you up for success, and we've
correct.
talked about those, but things like starting to move your body, starting to track your food, starting to look at your portions, starting to work on those healthy habits
Yep,
before you go in, but it's
sure.
not like you have to, but I
You
would
don't
highly
have to
recommend it. And there's
yeah,
some tests that you have to get done once you're in the
once you're in
program,
the program.
but again, those likely will not deter you from
Nope,
continuing on, right? Like you have to get
yeah,
blood work. Some people have to get sleep studies. Some people have to,
ultrasounds,
yeah,
yep.
scopes, that kind of stuff. I didn't have to have anything, knock on wood, other than blood work.
I
But
had to do a sleep study. Ugh.
oh, mwah, mwah. Yeah, there's certain
Yeah,
requirements that they'll say, like your weight, your BMI, your neck circumference, da da da. But again, that doesn't mean you
yes,
can't have the surgery.
no,
It
and
really
this is
honestly,
all post-orientation,
yeah,
so
it really is just, do I want to have this surgery? Do I feel like I'm in the right space for the surgery? Have I tried other things to see success? And am I ready for the commitment and the lifestyle changes that come along with it?
are you 18 years or older? Do
Yeah.
you have obesity or morbid obesity? So, basically, is your BMI over 30? Let's be
Yeah.
honest. Do you also suffer from any of the following? Heart disease, diabetes, high blood pressure, sleep apnea, acid reflux. Like, there's a
Yeah.
lot of like all of that will like, oh yeah, you absolutely qualify.
Yeah.
Yep, boom, straight to the here you go.
Yeah,
That's it.
because it will ultimately make those things better.
Yeah, because
Yeah.
basically, if you're 18 and let's say your BMI is 30,
Yeah.
there might be a conversation of you're a bit young, you don't have any comorbidities. Why don't we try Ozempic instead? Right?
Yeah.
Like, but for most of us, we're over 18. We had a
Yeah.
really high BMI, but they're not even really looking into that. But we have really high excessive weight for our height. We
Yes.
usually also have a comorbidity. So
Yep.
there is something else going on, whether you want to admit it or not. And family history counts, by the way. You don't have
Yes.
heart disease, but heart
Yes.
disease runs in your family. That's a comorbidity that will be
Yep.
passed on to you. That counts.
Yep.
And then, are you a drug addict? Are you an alcoholic? Do you drink way more than you should be?
Yep.
Have you had major cancer? Do you have psychiatric illnesses? That is it. That is it for eligibility. And that's just in Canada to get into the bariatric program. If you're paying for it, it's probably different. And
Yep.
again, we're not going to cover what comes after that because the question was, what do you have to do before you get into the program?
Yeah.
Nothing. There was no conversation of, Hannah, you need to go out, try to lose weight and prove that you've
No.
tried for at least a year to get in. Nope. There was, okay, well, you need to be on an eating plan for at least a year. And then, nope. And if your doctor in Ontario, Canada, tries to tell you that before he'll even submit, they will submit you, you need to lose weight or try eating differently,
Find a new doctor.
find a new doctor because the only requirements to get in are your age, your current weight, and if you have any of the we can't really take you because of it issues, cancer, psychiatric illness, drug or
Yeah.
alcohol dependency. And when they say psychiatric illness, having anxiety or having
Like,
depression,
we're talking
like
severe.
not like we're talking like you have bipolar 2,
Schizophrenia.
you have,
Yeah.
severe clinical depression.
Yeah.
Those are things you probably need to have and it's not a no,
No.
it's, you
Do you
can't
have the
just
right supports in place and the right medical
it's like applying for a
team
credit.
around you, right?
You
I'd say
wouldn't be
honestly. Yeah, go ahead.
you'd be flagged. Like, you
Yes.
would not be declined, but they would go, "We can't
Mm,
take you at this moment till we talk to some other people."
right.
Cool.
Yeah. It just means then that the team at the clinic might work with you more, you might have more appointments, they might wanna speak with any of the other physicians or
You're
team
on
that you're
call with
working
the
with. Yeah.
psychiatrist.
It
Yep.
just means that your process might be a little bit more thorough, and that's fine. I think the real big, what I'd say is requirement, is just being honest. Being honest with yourself, being honest with your doctor, and being honest with where you're at, where you've been, and where you're prepared to go. And
Yes.
I've even talked to people recently about this, and they've said, like, "I'm not sure." And I said, "Well, then talk to your doctor about it." I said, "There's no reason why you can't just have a conversation." I said, "You can ask me who's been through it, talk to your doctor, get the information." And you
Yep.
could always, the thing that I liked too is you could always start the process. And if at any time you didn't feel comfortable or you changed your mind, then you just said, I don't want to do this anymore. And that's it. And so just I think being honest is a big thing about what have I really tried? What have I really done? And I think the big thing is, again, the realizing it's not a magic pill. It's not like you're going to have surgery, it's going to fix everything. Really sitting down and researching, doing your homework about what is involved with the, like you're doing now, asking about the pre-process, what's involved with the pre-op process once I'm in the program, what's involved with surgery, with the recovery, and then what am I committing to long term? And I would say that's for me, I would tell people that I would treat that as a requirement, even though it's not. If I was talking to somebody who's thinking about this, I would say
Yes.
you should treat that as a requirement, is educating
Yes.
yourself, doing your research,
Yep.
and
And
having those honest conversations with yourself
and
about
knowing the
what you're ready
different
for.
surgeries because
Mhm.
you won't always get to choose that, and that will become
Yep.
something that you need to kinda pay attention to. The big thing that I will tell you for me that's a requirement like, well, we need to give this a name. It's not a
Right.
requirement, but it's a Hannah and Steph requirement. Trademark.
Highly recommended.
Highly recommend. You need to quit your alcohol and drug use, and when I say
Yeah.
drug use, I'm talking about marijuana. There oh, sweet Jesus. There was
Goodbye,
a post
gummies.
on Reddit last week, and I'm not kidding. Somebody went into the bariatric group on Reddit and was
Yep.
like, "Hey, how soon after surgery can I have a bump?" And for anybody who doesn't know, I haven't
Oh, wow.
done this, I know what they
Wow.
meant. They wanted to do cocaine. They were going to a party and they wanted to have a little bit of cocaine, and
Wow.
people in the comments were like,
I love that
"What
they're
the"
just putting that out there so
100%.
nonchalantly
But people
also.
in the comments were like, "What the fuck's a little bit of cocaine?" And they were like,
Ay, ay,
"No,
ay.
don't do like, you need to go research
No.
transfer addiction now." So when
Yeah.
I say drugs, I mean marijuana. If you're doing other drugs,
Yeah.
maybe don't have
That's a
your
whole 'nother topic.
as like
But, like, put
any
your gummies away.
if you're a heavy drinker,
Yep.
especially a heavy social drinker or a heavy marijuana user, you really need to think about this because transfer addiction is massive. And what
Yep.
happens is you can't eat, so you overdrink or you overdo drugs.
Yep.
And I'm not talking it happens to 5 or 10%. We're talking over
A
60%.
lot.
People that don't cut alcohol before surgery. get transfer addiction. You'll
Yep.
see it on Reddit. You'll see people being like, "Oh, I'm 3 months post-op and I can drink like half a bottle of wine and feel totally fine." Karen, that's not fine,
Yeah.
but cool. That is my, like, it's not a prerequisite, but you really need to think about it. Like, if you don't think you can give up alcohol, don't have this surgery. If you can't
Yeah.
give up smoking, don't have this surgery because smoking is the
Ugh.
non-negotiable that will actually, I forgot we should have mentioned it.
Yep.
If you're a smoker, you will not be accepted
No,
into
you
this
need to
program.
quit.
You have no
You need to
choice.
quit.
You
Yep.
cannot remain a smoker. You can't quit, have surgery, and go back to it. You full on fundamentally will be
You're done.
rejected if you're a smoker in Canada because it is stomach surgery, and if you smoke, it increases the chance of ulcers,
Yeah.
and you don't have a stomach left to afford an ulcer. And you can get hypertension and major issues
Oh,
after
so
surgery
many things.
from being a smoker, so they will not let you, and don't lie about it. If you're a smoker, you better
They'll
learn
know.
to quit or don't have this surgery. Go down the Ozempic path
Yep.
instead. But my rule or thing is like, if you don't think you can give up alcohol, then I don't know what to tell you. Like I haven't had alcohol in 3.5 years. Like I stopped the minute I got into the program because you have to give it
Yep.
up for the year before, because you can't, like you, for surgery, you can't have been smoking or drinking for X amount of months. So I gave it up before, and they ask you in every check-in, have you had
I
alcohol? Or are
don't.
you
Uh-huh.
introducing alcohol? And I never reintroduced it for multiple reasons. I'm scared shitless of transfer addiction
Yep.
because you definitely try to fill that food void. For me, it's shopping. Not great, but it is shopping. And then I don't want the empty calories and sugar because,
Yep.
like, it just rips through your body, and also I don't like the feeling of being drunk. Who enjoys that feeling? It's not great. So I haven't gone back to it, and I know a lot of the younger generation are actually giving up alcohol in general. So I think for some of the younger people entering surgery, this is not that big of
A
a
deal.
hurdle. But
Yep.
in my orientation, I was the youngest by decades. Like, it was a lot of 65 plus year olds that kind of have run out of options that need to have it. And giving up alcohol was like really hard. Every
Yeah.
other question in orientation was like, well, for how long? Well, when can I start drinking again? Well, I want to drink again. Um, I would just say, like, be careful because if it's
And
that
there I
much
was
of,
gonna say, there are people who do drink after.
which
There
is
are
fine.
people. And some people can handle it. And that's
Oh yeah,
yeah, exactly. That's cool. But
totally fine.
if you like Hannah said, if you are questioning your ability to be able to handle it
Or
or
you
to
used
be able to be one of those people who can have one drink and walk away, it's probably you're probably one of the people who should not go
yeah,
back to it. And if you want to drink post surgery, that's cool. If you think you can handle it, that's cool. But if you are one of those people that already is like jonesing and you're already thinking, "Oh
you
shit, I
drink
can't
every
just have
day.
one. I can't just have one. I can't just," then yeah, that's a different story
And your
because
friends
that's
will get
when it
over
will
it
come in.
because they do. But yeah,
Yep.
I like, if I
Yep.
had alcohol since surgery, yep. I had champagne one New Year's. I had a
Yep.
shot at Christmas once. But for the most part, that's it. I don't keep alcohol
Yeah.
in the house. I don't drink. Like, I think I've had two drinks
Yep.
total that I can think of since surgery. So in 3 years, because I count orientation in that,
Yeah.
I've had two. And I didn't finish the champagne because I was like, ugh, no
Ugh.
champagne is good. And the shot was just dumb. It was like a Christmas
It's
thing. The
just
whole
dumb.
whole family did it, and I was like, "I'd
Yep.
like to vomit." Like, it just did not
Well, and
taste
some people alcohol affects them totally different after surgery. You have to keep that in mind too,
good.
right? Like
Yeah,
there's some people will drink and it's fine. It's as if nothing ever happened and that's
yes.
cool. There's other people who will have one beverage and
Oof,
be
already.
blackout, white girl wasted,
Yeah,
shaking it on the dance floor with no recollection of what happened the next day.
and that's why they
So,
tell you,
just be
"Be
careful.
careful." Yep.
That's why
So
so for on my 40th birthday when we were in Canmore and everyone's like, "You can have a drink for your 40th? You can have a drink for your 40th? It's a big deal, it's your 40th." And I was like, "I don't know." At that point, I didn't know. I thought maybe I would, maybe I won't. We'll play it by ear. We'll see what happens.
yeah,
But my fear, and it wasn't the fact that I was worried about having a drink and that I was gonna spiral or anything. My fear was, I'm gonna be in a public place, not the comfort of my house. My children are gonna be there. I'm not gonna be at home. I'm in a different province. I don't want my first alcoholic beverage post surgery to make me the white girl wasted girl on the dance floor and have some sort of crazy horrible reaction in that situation. So I did not have alcohol on my birthday. I have not had alcohol since before surgery. I think it's been 16 months since I've had alcohol. And I might. Like I've honestly I thought about it on the long weekend. I thought maybe I'll have a drink. I just never ended up doing it. Um, it's not something that I feel like I have to do. Yeah, I might here and there. But I said if and when I do have a beverage for the first time post surgery, it will be
Mindfulness.
at home
Yep.
in the comfort of my own home in case I am one of those people who has a drink and
Can't
can't
do it.
handle it. Let's
Yep.
not have that happen in public.
Yeah. But again, these are not requirements. These are
Yeah.
just, we're kind of
Personal.
recommending.
Yeah.
We're kind of recommending that this is something that you consider doing.
Mhm.
Bo is going
Bo is
crazy.
chiming in on his thoughts here.
Give me a minute. But yeah, again, none of it is it's just our suggestions, but
Yep.
for those wondering, no, the bar is fairly low. And again, if you have any of the things that we've said would make you ineligible is not the right word,
No.
but would make them need to have a conversation with you, being a smoker,
Yep.
being underweight, being having had cancer, having a you think you have a psychiatric illness, just go talk to your
Yeah,
doctor
have a
or
conversation.
yeah, and, like, again, I wanna stress, like, cancer won't exclude you, you just
Yeah.
have to, like, have at the end of the day, still get put into the program because a
Yep.
lot of stuff they will deal with in the beginning, because you get into orientation, and then to get into the program, you have to sign a document, agree to a bunch of blood tests up front, and have
Yep.
a conversation with certain people to get into the program. So, there are
Exactly.
checks and balances, don't panic and be like, "Oh
Oh
my
my
god,
gosh.
I'm gonna sneak in and then they're gonna realize too late." They're
No.
not gonna realize anything too late. At the end of the day,
No.
if you're overweight and you're over 18, chances are you're going to be put into this
Right.
program
Right.
unless you've had major cancer or there's a major reason that your doctor um, was one of those reasons we listed.
Yep.
Sure, but if there's no reason and your doctor's hemming and hawing, if you really trust them, then listen. But if not, go find someone else to put you in the program
Yep.
because um, there's no reason to not be in it, to not at least be in it. Now,
Yep.
once you're in it, that's a whole other thing. That's not what the episode is about. That's a whole other thing. So if you get into it and they reject you while you're in it or they change things around while you're in it, that's different. But
Yeah.
just to get into the orientation and referral program, there's very, very,
No.
very, very little that should prevent you from being put into orientation.
Yeah. It's a
Very
conversation with your doctor and a referral piece of paper and welcome to the program.
If you don't have a
Go
doctor,
to the
go to a
clinic.
medical clinic.
Yep.
It's just a doctor has to just
Yeah.
submit you to the program. That's
Yeah.
it. Doesn't have to be a family doctor, it just has to be
No.
a doctor.
And I'm pretty sure when I talked to my family doctor, I said something about I was asking her, like, "Do you need information on this part of my history or whatever?" Like, we had talked about it, but she took some notes. But I remember asking her, like, "Do you need more info on XYZ?" And she's like, "Honestly, Steph, I check like 3 boxes, put your info on the sheet, and I fax it in." Like, it's not even like it was a heavy lift on her part either. So don't worry. Don't like I said, don't fear that you're gonna be rejected. Don't worry that you're not gonna get in. It is really just a simple process, making sure you've got your research done, you're in it for the right reasons, you've had those honest conversations with yourself, you're prepared for the changes that you have to make and the changes that you're going to have in the future, and
Mhm.
then start the conversation. And like I said, worst case, you have the conversation, you do the research, and you think, okay, maybe this isn't for me. That's okay too. But just have the conversation. And if
Have
you
the
have any
conversation.
questions, you can message us. We are again, we're always happy to chat.
We're not medical experts, so again, if there's something that has come up and your doctor and, like, we're not advocating to not use your medical doctor, by the way, we're just saying if you think that they are making it harder than it
Yeah,
needs to be, but also if you have a good relationship with them or they genuinely are looking out for you, please understand that it's okay for them to ask questions. It's okay for
that's their
them to
job.
yeah, it is okay for them to
Yeah.
question you wanting to be in the
Yeah.
program. It's okay for them to push to say, "Do you think you can do this? Like, can you actually commit to this?" It is okay for them to maybe say things like, "I'd like to see you
Mhm.
try this,
XYZ.
this, or this," right? Like, that
Yeah.
is not the clinic's requirement, but if your family doctor thinks that he just needs they need to see a little bit more, like, don't be like, "Well, Hannah and Steph said I need to leave this doctor and go." What we're saying
No.
is if you have a bad family doctor and
Or
you
you
genuinely
don't have a
think
doctor. Yeah.
they're derailing you, yeah, if it's like someone that you've never seen before in your life and they're like, "I don't know, lose 20 pounds and come back." No.
Yeah.
But if it's your family doctor that you've been seeing for years, and like if Dr. Singh said to me, "I'm gonna need you to try Ozempic for a bit," or I'd like to see you try something before we like, I would do it because I was dedicated to get into this program. If
Right.
I thought he was yanking my chain and not getting me in,
Yeah,
I,
different story.
would maybe go somewhere else. But again, just want to preface, I'm not saying don't listen to your doctors,
Right.
folks. But just know that the clinic side of things, there is no major
Nope.
um, things that you need to do to get in. And there's nothing that you need to hit. There's no milestones you need to achieve, again, except for being cancer free for 2 years and not being alcohol or smoke dependent for 6 months. But there are no major milestones that you yourself need to hit. You
Nope.
just need to be 18 and fat.
Perfect.
Yeah,
Easy peasy.
easy peasy lemon
Nailed
squeezy.
I nailed those.
Ayo. But it was a great
Oh,
question.
it was a good question.
Great questions like that. We're gonna be back next week. We're gonna be talking and answering actually even more questions that you all have submitted.
Yeah, put
Um,
more in the if you're on Instagram, put more send us. Like, don't wait for us to put I put a question box the other day. You don't have to wait for that. Just send us a note and say, "Hey, can you talk about this?" Or, "Hey,
yeah,
can you answer questions on
cool.
this?" Just send them.
We keep a running list, so please
Yep.
do that. We're going to talk about calorie counting. We're going to talk about cravings and food noise. We're going to talk about a lot of great things. So
Yep.
keep them coming. This was such a good one. We love the shorter format. We hope you do too. So let us know what you think of the shorter
Mhm.
format.
Please
And
do.
like always, Steph, I really appreciate you being here with me today. And thank you to everybody listening.
Thanks, guys. See you in a week.
Bye.